Hey guys, it is Friday, June 29th, and I just thought that I would talk to you guys about my job duties at my current job. Since I've been there, I've been doing a lot more, and I'm learning new things every day. So, my primary duty at patients, so I go to the waiting room and I call them back. I get their vital signs. Where I work, every 6 months they require we get a height and a weight. So if they're there for a physical, obviously I'm going to get their height and weight. If they're there for some type of wellness check, like a Medicare wellness check, I do their height, weight, and we also check their vision on the Snellen chart. But if they're there for, I work for family medicine and urgent care. So if they're there for something simple like a medication follow-up, or if they're there for an anxiety or depression issue or a hospital follow-up, I'm just going to get their weight. I'm not going to get their height at those types of visits. Um, so I room the patient. When I get in the room, I sit them down and I go over their allergies, which include drug allergies, but if they have any types of food allergies or pollen, food, grass, any type of allergy, especially drug allergies, we put that in the computer system. And then we go over their medication list. Usually if they go to another urgent care or some type of facility that is affiliated with us and they're prescribed another medication, that medication automatically goes into their reconcile chart, and we can look at that list and see what new medications they've been put on. Or if they had some type of infection a couple of months ago and they finished the medication, it still shows up in that reconcile list, and we can add that or discard it from the list. So it makes it easier to keep track of that patient's medication. After I update their allergies and drugs, depending on what they're there for, if it's a physical for a female, I ask them if they get their pap smears, at an OBGYN, or if they do it there with the primary care physician. And if they get their pap smears with us, obviously I'm going to set up the room for them to get it there. But most of the time, everybody goes to the OBGYN because that is their specialty. And what else do I do? So after I go over all of that, I take their vitals. My doctor works super fast, so I use a pulse oximeter for getting their pulse and their O2 saturation. When I trained with the other doctors, they moved a little slower, so I was able to do a manual. And the only time, if I'm doing a manual pulse, the only time I'll do like a full minute is if I know they have a history of like a heart murmur or arrhythmia of some type. But normally, you can do 30 seconds times 2, or whatever method works best for you. You can do 15 times 4. However you can count their pulse in a timely manner and get them in to see the doctor and have the doctor stay on track with time is how you need to do it. But yeah, I do that, and then once I'm done rooming the patient, I step out, the doctor goes in and does their thing. When males come in for their exam, sometimes my provider will do it on females too, but they'll do an IFOB, which is the fecal occult blood test, where they stick their finger in the rectum to test for blood in the stool. I'll take that to the lab because my doctor is really good about putting the labs in there for me. I don't have to put the labs in sometimes. And then one of my other job functions is to administer vaccines or injections. The most popular injection is the depot testosterone, which is given in the quad. And it goes like in the hip area, kind of on the outside of your butt. And it's kind of like Makena, which is an oil that helps prevent premature labor. It's a really thick, oily type of substance, and it takes a little longer to inject into the muscle. But we use a 22 gauge needle for that, because if you use a smaller needle, it's not going to be able to fit through that needle very well, and it's just not going to go very well. So we always draw all of our medications up with a blunt tip needle, and then we administer them with the correct size needle that we need to. The only one we don't draw up, obviously, with the blunt tip is the PPD tuberculin test. We just use the tuberculin needle, and it's so easy because it's like made for it, so it's really simple to administer. But we administer Depo-testosterone, Depo-Provera. We give a lot of vitamin B12 shots for people who are anemic. And what else do we give? PPD tests, we do that. We have a lot of college kids coming in right now, and we have to send them to the lab to get their titers drawn. When their titers come back, usually they're not immune to like varicella or Hep B, so we give them those boosters. We have younger adolescents coming in for like another MMR vaccine or like a Hep B series. We have all kinds of stuff. So we have a lot of Tdaps and TD vaccines, and I was kind of used to that already because I gave 1,000 Tdaps when I worked in OBGYN because of the pertussis that is in that vaccine. We want to prevent that. We don't want babies having that issue. I dress wounds. It's very rare I get wounds, but my provider likes to remove warts, moles, skin tags, cysts. So I'll set up the room. We have a cauterizing machine. I put that in the room. I'll give him the lidocaine and different size needles depending on how big the item is that he's going to be removing. I'll set up all kinds of different needles along with the Novocaine and a blunt tip needle so he can draw up how much he needs. He's really good about drawing it up himself. I don't ever have to draw it up for him. He administers the cortisone shots. I don't ever administer those. I just get everything set up for him, and he mixes it and does his thing. He's really good about that. And what else do I do? So I do Medicare wellness checks. Medicare requires that they get a Medicare wellness check just to make sure that their health is up to par and that their living conditions are to standard. And you basically go through and you test their cognitive abilities, you make sure that their vision is good with the Snellen chart, and that's the big chart that you see the big E at the top, and then it goes down with letters. That's how we test their vision. And then you just put it in the computer along with their vitals. And they also have to draw a clock that tests their cognitive ability as well. We tell them to set a certain time. And once I'm done asking that and telling them to draw the clock, we usually will tell them, we ask them questions like, does your home lack handrails? If their home lacks handrails, they need to have handrails. So most of a lot of elderly folks, they like to have the rails in the shower, and we have to make sure that they have railings going up and down their stairs and on their porch. If they have throw rugs, they need to be the non-grippy type, or they need to be the non-slip type with the grippies on the bottom. My other job duty, obviously, is to refill prescriptions. So my provider, if it's a certain medication like Norco or Percocet, Vicodin, drugs that a lot of people abuse for the wrong reasons, if they haven't been seen in a certain amount of time, he will require that they are seen before he refills those medications because he doesn't want them, distributing them to people that don't need it and they're using it for the wrong purpose or whatever. So I do that. I refill prescriptions. I do prior authorizations through insurance. Sometimes insurance doesn't want to cover a patient's drug when they've already been on the drug for years, and that's really frustrating. So I go back and forth with the insurance companies trying to get something covered for that patient so that they don't have a lapse in care, because some people really need these medications, and if they switch insurances and the insurance is different and they only cover half or a third or not at all, that really puts a damper on the patient's care. They really need that medication. What else? What else do I do? I reply to patients through the messaging system. Sometimes they ask simple questions like, when is my appointment, or do I have lab work coming up, or do I have labs that I can just go get? And most of the time, the labs are just standing orders. They can come into the lab whenever they have a free chance and get their labs drawn. And then it comes into their chart so that way, their next appointment, the labs were already done and they can look at the levels. I do screenings for UTIs if we have nurse visits. People will come in to have themselves weighed, have their blood pressures checked, get a T-shot or any type of vaccine, get a PPD read. UTI screenings, we give them a questionnaire asking them, have you had any abdominal pain, nausea, vomiting, flank pain? Do you feel like you're going more often? Do you feel like you just can't hold it? Have you had a UTI before? A lot of people who have had frequent UTIs know when they have one. And if they're, I always say a frequent flyer, meaning they always have them. If they're a frequent flyer, the provider usually knows exactly who they are and what they have, so they send them the medication right away. But I'll use the UA dipsticks. I'll dip the stick. We have machines, which is pretty fancy. So I'll just stick the dipstick in the machine. It reads it. It prints out like a little receipt with, their pH level, their specific gravity, leukocytes, blood, all of that on there. And then I put that in the computer, and then the doctor will tell me, yeah, go ahead and send a urine culture and sensitivity. Or if they already know right away it's a UA or a UTI, they're not even going to bother with a culture. They're going to be like, yeah, I'm just going to send them their antibiotic. So I do those. We do pregnancy tests. It's weird because the whole time I've worked here, I have not done an HCG. So going from OBGYN and doing pregnancy tests all the time to this, it's like I haven't even done a pregnancy test, even though I've only been there like for 2 months. But I was just so used to doing pregnancy tests like all the time. But yeah, I basically do that, and then August 2nd is pinning for me. Oh, congratulations on getting pinned. That's so exciting. It's all worth it. So yeah, what else do I do at work? I'm trying to think of other things I do. I'll talk to patients if we have lab results come in, like if they get my facility, we have an x-ray room, and they can get x-rays done like right then and there. If the results come back and something shows up, or if their labs come back and there's something extreme, my doctor will send me a message telling me to explain like what it was found on the CT scan or on the x-ray, and have them come in so that he can talk to them face to face about the diagnosis. Excuse me. But most of the time, especially the diabetics, their A1C will either be really, really high or it'll be a little low. And, if they're managing their diabetes, and that's what I love about my job. Family medicine is so awesome because eventually you'll get to know patients well enough, like what they have. Like most of my patients have a combination of things, like they have diabetes and heart failure, or diabetes, heart failure, and CKD, chronic kidney disease, or they'll have renal failure and heart issues. It's always about managing their care. We're trying to take care of these people and give them the best quality of life, and that's what I like. We also have people coming in that are just trying to be healthier and lose weight and get on some type of program, so my doctor will prescribe them Contrave or some type of drug to help suppress their appetite, and then we monitor their weight and make sure that they're exercising and eating right. And it's just really cool to be involved with someone's care like that, especially the diabetics that don't want to comply with the diabetic diet. It is hard to eat no carbs and no sugars. There's like sugar in everything. It's so hard to look for things. And sometimes diabetics think they're doing the right thing by eating a bunch of fruit, but there's natural sugars in fruit, and they don't realize that, so that's why their sugars are still elevated. And then, we have to educate them and teach them about what they can eat, what they can't eat. A lot of newly diagnosed diabetics don't understand that carbs have sugar, so that's the reason they have to limit their carbs. So it's just really awesome to be involved in their care. I love educating them and trying to help them live a healthier life. We also get patients that want to come in to just talk. They have anxiety or depression or bipolar disorder, and we monitor them and make sure that they're going to their psych appointments and going to therapy, doing their group exercises, whatever they're recommended to do. We make sure that they follow up with it and do it. And most of the time, the places that they go to send an outpatient note letting us know that they did show up. Or if there's been a lapse in their care and they haven't shown up for weeks or a month, they let us know. And usually I'll reach out to the patient and be like, hey, I see you haven't been going to therapy, what's going on, are you okay? And most of the time they just feel they don't need it anymore, even though they should still go, but completely up to the patient. And what else do I do? I have my doctor sign printed out prescriptions, and then I'll take them up to the front so that they can be picked up by the patient. Floating, when I'm a float nurse, basically I do prior authorizations, I refill prescriptions, I answer questions that patients send through the messaging system. What else do I do? I'll do any type of nurse visit that comes in, like UTI check, blood pressures, weight, and what else do I do? I just float around and help people. Sometimes a nurse just needs a break and step away or use the restroom, or there's always cake in our break room. Patients will bring us donuts or cookies or something. So if they just want to take a quick breather, a 5-10 minute break, and they need me to room a couple patients, I will. That's why I like floating, because you just get to help everybody out. Nursing is a very tiring job. Like, it's worth it, but I was so glad today's Friday. This week has really kicked my butt, especially since this week was thrown off since I got back into town Monday night from the wedding. This was the longest 4-day work week I've ever had in my life. And, the week wasn't too bad. Like, we had a lot of patients, but it was like a steady flow. And then today, all the patients decided to cut up. They wanted this refilled, they need this letter filled out, they need this signed, they need this, they need that. And it was just like, oh my gosh, there's so much going on a Friday. And usually Fridays are pretty commonly back. So everyone today was just running around rampant. And when 5 o'clock finally hit, I was like, cha-ching, I'm clocking out. I need a break. I can't wait to have these 2 days off. But I really do enjoy my job, and I'm glad that I'm putting all of the skills that I learned from nursing school to use. Doing EKGs, I think in nursing school we did it on the mannequin maybe one time, and I've done 3 already, and I'm getting better. It's kind of nerve-wracking when you do your own by yourself, because you don't know if you're putting the electrodes in the right place. But different facilities like you to put them in different places, and my facility offers training on how they want certain things done, so I don't know if other places will, but I love doing the EKGs. It's awesome. And that's basically it. I have to triage patients. Sometimes they'll call with shortness of breath, chest pain. They might think they have an infection if there's pus oozing out of a wound. And most of the time, if they have chest pain, the number one thing we're going to tell them is to go to the ER, especially if their phrase is, it feels like an elephant is sitting on my chest, or, my arm is going numb, or I'm seeing stars, I'm getting dizzy, I have no appetite, my chest is burning. If they have a bunch of symptoms like that, the first thing we're going to tell you is to go to the ER. Do they go? 9 times out of 10, they know they need to go to the hospital, and they end up going. Sometimes they refuse, and they just want to come in and see the doctor first. And I tell them, we're going to run an EKG, and if it comes back abnormal, the first thing he's going to do is tell you to go to the ER, or we're going to call the ambulance for you, and they'll transport you from the facility to the hospital. So by then, they're usually like, yeah, I guess I should just go to the hospital and have all their tests and lab work done. So, gotta love jets. But, that's basically what I do. We all work pretty well as a team. Some people could work a little bit better on communication, but everyone I work with, for the most part, we're really good at communicating. Everybody has a personality, so there's never a dull moment. And most of us laugh and joke throughout the day to keep the day moving, because even though nursing is a serious job, if you take your job too seriously all the time, especially when there's no patients and there's a little bit of downtime, you're going to be miserable. You still need to laugh and have fun and learn to just work with the type of flow that you have. Some providers are going to be more busy than others, and some doctors are going to be less chattier than others. My doctor loves to talk. Me and him talk about things all the time. I've shadowed and worked with other providers that didn't talk to me at all. So it just depends on the doctor themselves. We also have NPs in my practice, or we have a PA too, and they're super nice. Some of them that, I've worked with before weren't that nice. So it just depends on the person. And I usually just feel people out, try to get a feel for how their personality is. And I kind of already know who I can play around with and who I can't. And some people have already noticed that I get super quiet around certain people. And I try not to do that, but I just know who I can play around with and who would snitch on me and be like, oh, well, I saw Amberly playing around, blah, blah, blah. And I don't want to start any drama or get in trouble, so I know who to act crazy in front of and who not to. But I always make sure that I have great customer service, even if it's a patient who doesn't have the best attitude or they're not in the best mood. You still want to give them a good experience and let them know that you're there for them. I enjoyed watching you. Have a great weekend. I'm off to my 12-hour shift. I'm excited about graduating. Oh, have a good shift. I'm so glad that you're graduating. That's so exciting. So yeah, that's basically all that I have to say. I just thought I would update you guys and let you guys know what I do. I'm really glad that I took this leap, and I'm glad that I accepted this position at this company. The next steps for me, I really need to pay off my debt to my community college so that I can start taking prerequisites to possibly get my BSN. I really want to go back to school eventually, and the fact that they do tuition reimbursement really makes me excited to go back to school, because like even if I'm taking the prerequisites at community college and I have a C or better, they're gonna reimburse me. So even if I can just take 1 or 2 classes a week, even a weekend class maybe, and just get some prereqs knocked out, that's what I'm gonna do, because I want to get there eventually. Hey baby! I gave my cat his flea medicine and he hates it and he's acting weird. But yeah, I'm here if you guys have any questions. I just wanted to hop on and let you guys know I'm still here. I have to cut out my Starbucks habit. I have one right now sitting next to me. That's what I keep looking at. I have gained so much weight and it's ridiculous. And where I work at, we're promoting health, and I feel kind of hypocritical when I tell a patient that they need to eat better. Eat greens, eat fresh fruit, don't eat canned vegetables, eat fresh vegetables, or steam in a bag, or frozen vegetables. And here I am eating like Jimmy John's or like a bunch of popcorn or crappy Chinese food. Like, losing my dad made me realize that I hit the lowest of the low. And I was talking to one of the NPs today at lunch, and she's really into health, and she was like, your whole life, being healthy your whole life is going to be a battle for anybody. We're all going to have bad days, we're all going to have good days. I'm expressing my sadness, anger, all of my emotions from losing my dad through food. I'm eating my feelings. And I told her, I used to be really strict on my diet. I was, working out 5-6 days a week, eating healthy, blah, blah, blah. And she was like, you'll get back there. You just have to take your time grieving, get it over with, and then you'll eventually slowly get back into it. So I really need to get back into it because my clothes don't fit anymore, and that's the part that really makes me depressed. So yeah, I don't like promoting health to my patients when I'm not a healthy nurse myself. And I know I can do it. It's just a habit. I don't have to have Starbucks to survive. It's just, ooh, Starbucks, it's good. Let me get it on the way home, or let me get it on the way to work. There's days where I'll get a Starbucks in the morning and a Starbucks in the evening, and I know that's horrible for me. But I do it anyways, and I gotta stop. But yeah, it's pretty much my job functions. I just wanted to hop on and talk to you guys because I miss making videos. I don't have any video ideas. What else can I talk about? I'm just so glad it's Friday. I'm so tired. And being a nurse is exhausting, especially depending on your job duty. Like, some nurses, it's just your job to room the patient and get their vitals, and that's it. Sometimes you're going to be doing it all, like I do, rooming, pulling the patients back, rooming them, filling out prescriptions, getting the doctor to fill out paperwork, signing, faxing, scanning stuff into the patient's chart. You're doing it all. And you really have to learn how to get into your own rhythm. You don't want to follow someone else's rhythm if it makes you uncomfortable or it's not the way you want to do things. I went to Dollar Tree and bought like some folders and a couple of things that I'm going to use to help organize the way that I work with my doctor. And then when he leaves, hopefully the new doctor coming in that I'm going to be working with wants to do the same thing. Because the way that the nurse did things before me, it's not the way that I want to do things. And I'm slowly starting to see like, okay, this is the system that I want to put into place to help keep me, my doctor, and my patients organized and on the same page. I want their paperwork to get done in a timely manner, and it's just less stress mentally. And I think where I work at now, it's more of a mentally stressed job, not physically stressed, because you're replying to patients through the messaging system. You have to look up their medications. You have to refill those medications. You have to do the whole insurance thing, and if it doesn't get covered, you have to find ones that do get covered, and it can just be really frustrating. So that's about it. I'm going to take a sip of my drink because I keep staring at it. It's just so good. Oh, I have to stop though. And I went to Dollar Tree. This video is all over the place, but I went to Dollar Tree. I got 3 big white poster boards, and I decorated them into 3 phases for the 80-day obsession with Autumn Calabrese from like Beachbody. So I'm probably going to start that on Monday, because that's when I want to really get my diet in check. I do not want to look this big come next year. And I've been slowly weaning myself like off of Facebook. I haven't been getting on as much, because looking at people and how good they look in their bathing suits and all the vacations they're taking, I'm just like, oh my gosh, like I can't do any of that, and I'm way too fat, and I just don't like the way it's making me feel. So I'm probably gonna like delete that for a little while again. I love taking social media breaks, because the more breaks I take, the more I realize I don't need this. This isn't benefiting me at all. And I work with a couple of people who are my age, and they don't even have Facebook, and I'm like, well, how do you do that? Like, it was just weird to hear that someone my age don't have a Facebook, and they were just like, I just don't. Like, it's drama, there's rumors, there's fake articles, there's all kinds of crazy crap. And the more they talk about how bad it is, the more I realize how bad it is, and the more I realize how I don't actually need it. And I would like to just take a hiatus and focus on my health, and then do like a before, during, and like after social media breaks, so that I could show off like my new healthy body and all of that good stuff. But it's mind over matter. You know, I always say that I'm going to do these things, and then I don't, and I just need to do it. So I need motivation, and I need a good support team. I've thought about joining a different gym, because they built one near me that has a pool, and it's like $30 a month, and I'm already paying $20 a month at Planet Fitness, so I might switch since my contract is up, but I don't know yet. So just wanted to hop on and talk to you guys. I'm so glad that somebody is graduating from nursing school. It's so exciting to get pinned. Like, pinning for us, we had to wear like the old style, like white nurse dress gown, white shoes, white stockings, the cute little white hat with the red trim, and I loved it, because, you know, that was like the foundation of nursing. Like, that's how we started out, and it was just amazing. So all your hard work is going to pay off, and you're going to realize that when that pin goes right through that little collar. So good luck to you. If you need help studying for the NCLEX, or if you have any questions, let me know. The NCLEX, it's straightforward. Do not overthink it. Like, when I remember when I went in to take it, I was just like, you know, you're either going to pass or you're going to fail. And I passed, because you have to take your time. If you have to read the question 4 or 5 times, read it. Do not just click a button because you think that's the right answer. And do the elimination system. You know, read the question a few times and be like, well, I know it's not these 2 answers, it could be these 2. And then kind of talk to yourself in your head, like, why it would be this one instead of that one, and you'll probably pass, because that's what I did. So I'm gonna hop off of here. I had a lot of fun talking to you guys, and yeah, I'm so glad it's Friday. I'm so exhausted. Like, I'm kind of just in like autopilot mode. I don't even know what I'm doing this weekend. I'm about to just lay on the couch right now and like watch The Walking Dead and hang out with my cat, because my boyfriend's at work. So if you guys have any questions or comments, let me know, like always, and I'll make a new video for you guys soon.